Do you worry that you may have or could acquire a serious medical illness? Do you constantly research disease symptoms online? Do illnesses like cancer, heart attacks, multiple sclerosis scare you? This is about when I was a newbie nurse, and I met a nurse who had been working on the cancer floor for quite a few years. Erica had health anxiety, and she could not overcome it. She couldn't fall asleep at night, and she would lie in bed. She could not take her mind off the fear that she had a brain tumor, even though many different doctors reassured her that everything was just fine. She would talk about her headaches that she got for no reason at all, or sometimes she'd have some dizziness. She said there must be something terribly wrong that the doctors are just missing. So she felt so anxious. She would get out of bed to check the internet for more information. She read more of the symptoms of brain cancer, as similar to what she was experiencing. So it was increasing her anxiety and growing an urge to contact another doctor. She had health anxiety. She had a preoccupation with having or felt like she was in danger of developing a serious illness. Many people with health anxiety are not able to function or enjoy their life due to preoccupation. They become preoccupied with their bodily functions, such as their breathing or their heartbeat. Or they may notice minor physical abnormalities, such as a skin blemish, or a sensation like a headache, a stomach ache. They might even worry about a specific organ, such as their heart, or a disease that they just heard about in the news. As Erica had experienced on her floor, today it could be the coronavirus. And many people are reluctant to see and seek treatment, mental health treatment, because they're afraid very strongly that their condition really occurs from a medical illness. First of all, medical problems with Erica were ruled out. She had a thorough physical examination. She then began what started to be called CBT, or cognitive behavior therapy. And it was focused on her cognition, on the way she thought, her behaviors, and the way she acted. The main concept behind CBT is that our thoughts about a situation, such as the fear of this recent virus, affects how we feel. We become afraid, we become anxious, and we can be scanning our body, going to the doctor, checking our temperature every 5 minutes. We tend to assign meanings to specific situations. Even a slight cold might mean something to the person who's having difficulty. It's not the actual situation that causes our anxiety, but the meaning, whether it's accurate or not. And when someone has anxiety, you give your thoughts a lot of meaning and a lot of power over yourself. I learned many years ago how to use CBT to help overcome fears of correcting irrational thoughts and changing problematic behaviors by creating a certain mindset. And who do you think the first person I helped? It was Erica.